Okay, thank you very much. And first, I start with lessons from the field. How was it like in Liberia amidst the outbreak? And the first thing was that this was an invasive enemy called Ebola for the first time for Liberia to hear about a sickness, and that we told them that it had an incubation period of about 3 weeks, 21 days. It struck Liberia in the midst of a weak health system, whereas the health system was actually not prepared to effectively respond to the epidemic. The outbreak affected the health system itself, paralyzing the entire system. Affected the people of the country and also the socio-economic system of Liberia. And of course, in the midst of that, we had these conflicting messages that did not resonate well with the public. And as a result of those activities, we had a misconception, disbelief, fears, community distrust, and resistance within the communities. And of course, there was this a refusal to seek care at the Ebola treatment units and hospitals. And of course, we also experienced religious and cultural practices that affected the smooth. May I just have a little move on the slider, please? Am I okay? Am I clear? Or is that a freeze somewhere?
We can see most of your slide, but if you could click the presentation icon, we could see the whole thing.
Oh, okay. I think that's a freeze. No, please can help me. Okay, I'm sorry. We're having some technical issues on this side, but we tried our best to make sure that you just on the slide of the movie.
It's slideshow. On the top bar, it says slideshow.
Okay, slideshow. What is it? Remote new share participant start video. But what is not showing? It's not showing. But is that we can?
It's at the bottom of the slide, highlighted in yellow. Right. Bottom right.
Bottom right.
Okay.
Okay. Is that okay?
That's perfect. Thank you.
Okay. And then there was a refusal to seek care at the Ebola treatment unit and, of course, at hospitals because the fear, distrust, and resistance. And, of course, there were religious and cultural practices that affected the smooth communication within communities. Then, of course, we have to rely on data information that provided the evidence to see the way forward. And one of the data used during the Ebola crisis in the midst of all that transpired was the surveillance data. And I'm going to just give a brief summary of what it showed. They reported the first case of Ebola in March 2014 from Lofa County, and they reported a number of Ebola virus disease cases amounting to over 11,000 cases, including 375 cases among health workers. And of course, the death was nearly 5,000 with 189 among healthcare workers. And of course, there were survivors, about 1,538 survivors, broken down as male 46% and female 54%. But more to that, the data also provided some guide to us to see how the trend of Ebola crisis in Liberia went. Between the period March 2014 to April to June, there was a low level where it actually subsided a little bit. Then by some part of June, it started climbing up. So that's why you see the red arrow showing us that there was a lot of cases that were reported in Liberia. And then it went up and then started sliding down in 2015 around March. So that shows us the picture of how data was also telling us how the picture was like as it relates to the Ebola outbreak in Liberia. The surveillance data also provided information on the communities that were affected, the number of people who were on the contact list for follow-up or being monitored, and the number of people admitted at the Ebola treatment unit. They also reported alleged, suspected, and confirmed cases of Ebola and other priority diseases. And of course, apart from that, the surveillance data, we also had the anthropological studies that provided some basic information as it relates to understanding reasons for community fears, distrust, denial, and quality of care that led to delay in seeking care. Of course, the widespread opposition to cremation and Ebola-related stigma. ETU services, that's the Ebola Treatment Unit services, and public concerns about patients taken to the ETUs for treatment. And to better understand why Ebola viral disease-related deaths occurred at home in order to reduce such occurrences. Of course, there were issues of stigmatization of Ebola patients, relatives, and close associates, and to understand cultural and religious factors associated with burials and hiding of sick people to improve EBD response. So those were the kind of studies that were done, the epi-surveillance report data, and then the anthropological studies that was also done. But we have to understand the knowledge, attitudes, and practices of people in the various communities so that we can readjust our messaging and so on. So what we did was we conducted to explore community perception on the Ebola virus disease, to determine the level of awareness and current practices for prevention and control of the Ebola virus disease, and to identify correct and effective practices that will reduce the risk of contracting the virus or spreading the virus for that matter. The KAP also provided a basis for understanding current state of knowledge and attitudes towards EVD, that's the Ebola vaccine virus disease, and gauge the success of social mobilization efforts. The KAP also provided, explore cultural, social, economic factors that influence the adoption of recommended preventive behaviors. And of course, they serve as guiding tools in fine-tuning messages and communication strategies. And the KAP continues that it was also conducted to identify correct and effective practices to reduce the risk of spreading the virus and to understand the current status of knowledge and attitude towards Ebola vaccine virus disease and guide the success of social mobilization and to determine awareness level of the Ebola virus disease. To also explore the perception of the community on the disease. Another thing we did was a rapid assessment, and the conduct of the rapid assessment was done so that we assessed messages, materials, and activities for the response. How well were people understanding? We wanted to know their understanding where they were practicing, those behavior change attitudes or practices that we are recommending to them, and also to gather information from intended audiences so that we can redesign our messages. And of course, the rapid assessment was to assess communities' involvement and support for the EBD response. Conclusion and summary. Why is data important? We said that data is important in social behavior change communication to determine if messages are resonating well with the audiences. So if we don't have the basic evidence to see whether people were practicing hand washing, whether people were conducting safe burial by calling the hotline so that the health workers will collect those sick people and take them to the ETU facilities, we needed to understand. It was through data that provided the evidence for us to do that. The data provided factual information as a basis for planning and decision making. When we first started off with the messaging on the Ebola crisis, we said it was deadly and it had no cure. And it caused more problems for us in our communication drive. Therefore, we have to use data to assess the perception of people and the way forward so that we could have a positive response from the congregation, from the community. So we had to do all of those things using data. Data was also used to assess need for improved communication, messaging, community engagement, and strategies to mitigate public fears, and then to increase demand for care or services. So all of what we did in terms of our social mobilization strategies in the messaging and the community engagement, we had to rely on data. And those are some of the data, whether they were qualitative or quantitative, we had to use them so that we can make decisions that will help people to take appropriate action to prevent the spread of the virus. At this time, Rima and Raphael and all of those distinguished personalities listening, taking part in the workshop. From Liberia, we have a unique word to say to express our thanks and appreciation to those who have invited us and then to organize these things so that we can be a part of it. We'd like to say a Liberian colloquial. It's from one of the vernaculars, and this comes from Bone County, where I hail from, to say imama. And the word imama is simply to say, thank you very much. We appreciate the gesture inviting us to be a part of this workshop. May I say thank you and say imama again to the U.S. National Academies for organizing this workshop. Thank you very much and I appreciate the effort so that we can be a part of it. Thank you.